Welcome to the NBA. You're in the Army now. The few, the proud, the Marines. Dear, insert your name here, the Admissions Committee of the School of Medicine of the Virginia Commonwealth University is pleased to inform you that you have been selected for admission to the freshman class beginning in August 2010. These statements are all indicators that a person has accomplished something great. You have worked hard, and now you are here at the School of Medicine. This is an exciting day for all of us, for you as you embark on this stage in your life, for your family as they ready themselves to support you on this journey, for the faculty as they prepare themselves to shepherd a new class of students into the family of physicians who have graduated from MCV, and for me as I have the opportunity to reflect and share with you today. This is a big deal. You are not just going to school, you are joining a profession, an institution. I've served on the admissions committee for 9 years and on the professionalism committee for about 10, and I am honored to have this opportunity to share some lessons that we have learned from our work with you here today. You are sitting here with about only 3% of those who applied to join the MCV class of 2014. You knocked on our doors, and after a rigorous admissions process, we welcome you to your future, the practice of a never boring, sometimes frustrating, and almost always fulfilling profession. Over the next 4 years, you will learn not only facts, but a way of thinking. To deliberately misquote a movie from a long time ago, we will train your minds. You will teach yourselves the science of medicine. You come to MCV with a brain full of mush, and you will leave here thinking like a physician. Learning this way of thinking can be challenging, so let's not wait. We'll start now. You already had your first biochemistry quiz, right? Okay, we're going to move on to ethics. To help prepare for this talk, I must admit that I looked at videos of some previous speeches, and there are some things that were said in those speeches that I want to make sure that I do not forget to say. Welcome to the family of MCV. You are going to grow emotionally, intellectually, and spiritually at the same time. Caring is an important part of curing. Every patient is not pleasant because we see them at their worst. And patients won't care how much you know until they know how much you care. These are important and very relevant comments that were made by some very impressive people, and I wanted to make sure that I had the chance to say them too. They relate to humanism and altruism, which are two essential components of professionalism, and professionalism is what I want to talk to you about today. So, I did not have the opportunity to participate in a white coat ceremony when I was an M1 student because this program wasn't figured out until about the time I became a faculty member. I took the Hippocratic Oath for the first time as a graduating senior, which is what happened back in the day. I believe, however, that the ceremony is an important one. As I look back on my tenure in medical school, I realized that the faculty was working very hard to inculcate in us during 4 years the essence of what you're getting in this ceremony today. The entire time they were teaching us, you get today very clearly. Similar to MCV, the school that I attended focused on our learning to treat the neglected and the underserved. We were raised to believe that our goal was to treat those patients that would otherwise not be receiving excellent care. We were taught that patient care was going to be our ongoing priority in life. Patients are the reason why you are all here. You have been driven to help care for patients, regardless of the specialty you've chosen, regardless of how you intend to use your medical degree in the future. I remember sitting in orientation my first day. This was a lifetime ago, literally, before many of you were born. At our orientation, we were told, look to your left, and look to your right. One of you is not going to be here by the end of the first year. And it was true. It happened that our class was roughly half female, and that was rare in medical schools. We spent 8 hours a day in class, and we went home and we studied some more. We started our real work with patients in 3rd year, and we could not wait to get there. We introduced ourselves to patients as, "I am young Dr. So-and-so." When we were asked by a patient if we knew how to do a procedure that we were doing for the first time, we said, "I've never had difficulty doing this procedure before." When it was time to learn a procedure, we saw one on a live patient, did one on a live patient, then we taught our classmate how to do one on a live patient, and then we called ourselves experts. We pulled call and stayed all night in the hospital, and then we stayed the next day until the work was done. I still remember when I was on my surgery clerkship that my chief resident could not remember where she parked her car 5 days before because she'd been in the hospital that entire time. Times have changed. Your class has been here for 5 days of orientation. You've had testing, you've had support, you've had all kinds of welcoming. 96% of you are going to graduate from the School of Medicine here at VCU. It is common for classes to be at least half female. VCU's class is more diverse than ever before. You come from 22 states, 3 different continents. You have a much more civilized schedule throughout your medical training, and your generation is going to make sure that physicians have a more civilized schedule for the rest of their work lives. You will begin seeing patients regularly within your 1st year of medical school, and when it is time for you to learn how to do a procedure, you will learn on a standardized patient or a simulated patient, not a very sick live patient. Times have changed. And you are going to change over the next 4 years and throughout your training. Maybe you won't change so much as you'll come to know yourself. You'll come to recognize the medical professional that you were destined to become, that the admissions committee recognized. You have been through quite the gauntlet and inspections by the admissions committee to get here. You know a lot about earning good grades. You know how to take a multiple choice exam. You know how to write good essays, and you know how to find a good interview suit. You know how to give an excellent impression in 30 to 60 minutes to a member of our esteemed admissions committee. You are already smart, motivated to care for others, and hardworking. We know 3 things that will help a medical student achieve and graduate from medical school. 1 is a strong work ethic. 2, a willingness to ask for help. 3, an ability to defer gratification. You already know how to do 1 and 3, or you would not be sitting here today. But you may not know how to do number 2. You may not know how to ask for help. You are smart and accomplished. Some of you have earned straight A's or close to it throughout your entire academic careers. It is, however, hard to stand out in a class full of other excellent people. Please know that as a physician, the most important 3 words that you can know are "I don't know," and its corollary, "I need help." You must learn to ask yourself every day what you know and what you don't know so that you can figure out how to do the best thing for your patient. Only then are you able to ask for help to take the best care of that person. This may have happened before in your life, or it might happen for the first time this year, or it might happen later. I remember my sophomore year in medical school, I thought I was drowning, and I asked 2 of my peers for help. And fortunately, they were gracious enough to pull me into their study group. I was so grateful, and I still am today. Again, you already know a lot. You're going to learn more as you enter one of the noblest professions, caring for the sick and providing patient care. You will learn the technical aspects of the human body and mind, its physiology and its illnesses. You will learn more than you already know about the principles of professionalism that you brought here: altruism, humanism, accountability, excellence, respect for others, a personal commitment to lifelong learning, duty, honor, and integrity. It is these principles that keep us from being mere technicians but make us physicians engaged in the practice of medicine. So although you are in school, you are not just students. We want you all to own these principles now and begin living by them now. This 4-year time is not just school, but a transition time and the beginning of your development in the profession. As you are learning, you are beginning to think as a physician. As such, we also want you to begin to behave like a physician in the best sense. And this is what the white coat ceremony is about. Why is this a big deal? Well, we have come to know that medical students with professionalism concerns become physicians with professionalism concerns. What does it mean to behave like a physician as opposed to behaving like a student? It has been said that integrity is what you do when no one else is looking. Sometimes as a student, we might cut a corner here or there, but as a physician, cutting corners can lead to disaster. As an undergrad, I'm thinking you might have crammed for a test or two. You pulled an all-nighter and you eked it out. You saved your GPA to keep it intact for your medical school admission, your medical school application. It may not have been a big deal if just having the material in your short-term memory meant you weren't going to remember it later. You may have said to yourself, it won't matter, I'm going to review it later, no one will know. I challenge you now to realize that the thought is, but I'll know. It matters because it may matter to a patient. I challenge you to recognize that the material that you forget might impact your ability to care for patients in the future. In the past, you might have helped your buddy out by signing him in for a class when he was late or absent. You've done a friend a favor. So if you say no one will know, I challenge you again with, but I'll know. I challenge you now to think, would you sign someone in as having performed a surgery if they weren't in the room? In the past, you might have cut a class because you had something else you wanted to do. I challenge you now to consider that if you don't meet your assigned responsibilities because you want to see something else instead, it might not be the best thing for the patient or for you. Who'll know? You'll know. You are no longer just a student. You are a student physician. As I conclude, I need to say that I so enjoy what I do every day. I have a hard time leaving home, and I have a hard time leaving work because I enjoy what I do in both places. When I'm in a bit of a mood, I can get myself right just by talking to a patient. You are joining this great profession where you can make a difference every day for somebody. I tell my children that they don't want to just have a job, but they want to have something that they can do they can enjoy. I cannot imagine having a job that did not make me feel like this. Now, neither of my children has chosen medicine, but you have. So welcome to my family.